Ultron. All right, welcome back to health assessment. Okay, so I checked the patient's chart. I see that she's in need of a head-to-toe assessment. And so I'm going to come into the room and introduce myself. Hi, I'm Chris. I'm going to be your nurse today. And can I get your name and your date of birth?
Jessica Meek, 11/30/93. It's my birthday.
It's her birthday today. All right. So we're going to be doing a head-to-toe assessment on you real quick. I'm going to provide for privacy, pretend land. And I'm going to start off just by asking a couple questions. Is that all right with you?
Yes.
Okay. Can you tell me where you are right now?
Baker.
All right. You're at Baker. And you said it was your birthday today, and you gave today's date. So that means you're A&O times 3. We're oriented to time, person, and place. So I'm going to just ask you a few questions about what's going on with your body now. All right?
Okay.
So do you have any problems with headaches or seizures, tremors?
No.
Nope. No lightheadedness or anything like that?
No.
Okay. How about eyes? Do you have any eye pain, discharge due to eye infections or anything?
No.
No. How about your ears? Do you get ear infections or any trauma or trouble with the ears?
No.
No. Nose? Do you have any difficulties breathing?
No.
No. No asthma or allergies or anything like that?
No.
Okay. You're real easy so far.
Thanks.
Okay.
Chris, I want to speak up a little bit just because they're loud out there.
Oh, okay.
I think you're good, but
All right. Now, how about your mouth? Do you have any sores or troubles? Do you have any pain in your mouth at all?
No.
No? So, do you have any trouble breathing at all? With do you get out of breath easily? Does your heart flutter ever?
No.
Have you ever been diagnosed with a murmur or hypertension or anything?
No.
Do you drink or smoke?
I smoke.
Okay.
Don't drink very much.
How often do you smoke?
Maybe like a pack every 2 or 3 days.
Okay. Well, I would advise you to quit smoking if you ever feel up to it.
I'm aware.
And, okay. Do you have any stomach pain at all?
No.
No? How about, have you ever had any surgeries to your stomach?
I had a cholecystectomy.
Okay. All right. Make sure that gets into your chart then. Is there any, but there's no pain residual from that surgery, right?
No.
Okay. How about your hands and your feet? Do your hands and feet ever get cold?
Not abnormally,
Not
no.
abnormally. Just normal for Michigan?
Yeah.
Okay. And how about weakness? Do you ever feel weak, or do you ever have trouble walking, running, anything like that?
No.
No? Perfect. Okay. So I'm going to begin by assessing the head. Her head is normal cephalic and round. There doesn't appear to be any lesions on her face or her scalp. There is some minimal scarring over her left eyebrow. Her skin is pink, warm, and dry to the touch. And let's see. Just palpate. So her post-cervical lymph nodes don't appear to be swollen at all. Is there any pain you feel here?
No.
Okay. Her occipital lymph nodes are not swollen. And I'm going to move to the supraclavicular. I'm going to move to the post-auricular and pre-auricular. No pain?
No.
While I'm in the pre-auricular, I'm going to assess the TMJ. Can you open your mouth for me? Oh, you got a little bit of a click there. All right. She is able to open her mouth, though, which means that cranial nerve 5 is intact. Neither the pre-auricular or post-auricular lymph nodes are swollen. Submaxillary, the submental, and then the all right, Jessica, can you lean your head over to the side for me? All right, now I'm assessing the deep cervical. And neither deep cervical, superficial cervical. There doesn't appear to be any tenderness. So there Her lymph nodes are fine. Now I'm going to palpate her throat. Can you go ahead and swallow for me, Jessica? Her thyroid moved when I palpated, and her trachea is midline. There's no deviations there. So now I'm going to feel her carotid artery. Carotid's at about a 3+ on the left. It's a little bit bounding. And a 3+ on the right. But the rhythm and rate are regular in both. I'm going to palpate temporal. Alright, you can feel her temporal artery was at about a 1. So now I'm going to begin my ear assessment. Alright, Jessica, is there any pain when I pull on your ear?
No.
No? Alright, so I'm going to go around and feel the outside, the external meatus of her ear, and then the tragus. Any pain?
No.
Okay.
My ears are probably yucky though, sorry.
It's alright. No, actually they're perfect. There's no wet cerumen or anything. So there's no lesions or rashes, no wet cerumen. No wet cerumen in the left ear. And so now I'm going to begin the eye assessment. Do you ever have like blurry vision or double vision?
No.
No? Okay. So I'm going to start just by having you follow my pen, okay? All right, and as I'm doing the assessment, she was able to follow my pen. Her sclera is white. Her pupils are at about 3 or a 4 on both sides. They're equal and round. And so now I'm going to have you just look straight ahead, okay? And I'm going to shine the light. So her eyes are her pupils are equal, round, and reactive to light and accommodating. Okay. All right, now I'm going to look at your nose. Can you lift your head up? All right, as I look into her nose, her septum appears to be midline. There's no deviations. I also note at this time that there doesn't appear to be any drainage come from her nose or the conjunctiva of her eyes.
You're good.
Okay. So, could you put your finger up on this nostril? Can you breathe still? Kinda? Alright, how about the other nose? Okay. Both noses are patent. Do you ever have any trouble smelling?
No.
No? So that would indicate the cranial nerve 1 is intact. We're going to look at your mouth now. Is that okay?
Sure.
Can you open your mouth for me? Can you say ah?
Ah.
Alright. Did you have your tonsils removed?
Mm-hmm.
Alright, so the buccal mucosa, cheeks, gums, and her lips are all pink and moist. The teeth are intact. Her tonsils are not present. And she's not wearing dentures. So she was able to say ah. Her tongue was midline. She pushed it out. At this time I could also use a tongue depressor to indicate that her gag reflex would be intact, which would be cranial nerve number 9. Cranial nerve number 10 was intact when the uvula rose midline, and cranial nerve 12 is intact as well. Can you go ahead and shrug your shoulders for me? Right. Cranial nerve 11 is also intact. So now I'm done with my head assessment and my neck assessment. So I'm just going to start taking a look at your breathing and your heart. Is that okay?
Sure. Do you want me to stay here or lay down?
Why don't you go ahead and lay down, please? So now that she's down, I'm checking for jugular venous distension. There doesn't appear to be any jugular venous distension. I would look for any rises or obvious lumps. I would look for heaves in her point of maximal impulse. And I'm going to begin my assessment by percussing the lung fields. We'll start at the top of the lung fields. All right, so on the right side, everything was resonant except for the spot right over her liver, which is normal. So now I'm going to percuss her left side. All right, and she was resonant in all of her lung fields, so now I'm going to begin my auscultation. Go ahead and just breathe normally. Well, your lungs are really clear. All right, is it all right if I come up under your shirt from here?
Sure.
Okay. Lung sounds are clear, no adventitious sounds on the interior side. So now I'm going to begin just by auscultating her heart sounds. I'm going to start by finding the angle of Louis. And then coming down on the right second intercostal space at the sternal border for the aortic pulse. Then to the left second intercostal space to the pulmonary. Then to the third intercostal space on the left side, the sternal border to Erb's point. S1 and S2 are noted. There's no sounds of murmurs or S3 or S4 noises, and her rate and rhythm are regular. So now I'm going to come to her L5, which is the tricuspid. Then I'm going to go to the midclavicular line at the L5. There's the fifth intercostal space on the left side, which is the mitral. All right. Rate and rhythm were regular on all the heart sounds. So now I can begin my abdominal assessment. So I'm going to start just by inspecting again. Sorry if it's a little cold. So there's no rises, no lumps or bumps present. There's minimal scar